Hey, how you doing, everyone? This is Dr. Raymond Gasky. I'm here with intern Jarrell Jones. We are today going to discuss wrist pain. So Jarrell here, in addition to being an intern for chiropractic, is a licensed massage therapist, so a lot of use of the hands. He comes to us today complaining of wrist pain right at the first metacarpal phalangeal joint, maybe somewhere into the thenar eminence. So for all of you student interns or for your doctors right now, you're suggesting maybe we do some tests. One would be the traditional Finkelstein's test for stenosing tendinosynovitis, which is an overuse of some of the thumb abductors and thumb extensors, this little tissue coming in this direction. So one test we know for Finkelstein's is, let's drop the thumb in and we bring it down. Now, is that causing any pain?
Slightly.
Slight pain. So we're getting an inconclusive on that test. We have other areas in here, for instance, being that we won't call Jarrell a spring chicken. He's been doing massage for a while, so we can talk about maybe some degenerative changes of the thumb joint, metacarpal phalangeal joint. We can test that right now with what I call the grind test, where we're going to take this first metacarpal bone, the first phalange, and we're going to see if we can grind it into the joint that houses that first metacarpal bone. And if this is causing any pain in the joint, we're going to call out a positive grind test. It might be indicative of just inflammation of the joint or maybe a basilar arthritis of that joint. We'll talk a little bit later about what kind of treatments we're going to do for it. Other tests we can do, since it's kind of on the palmar aspect of the wrist, I suspect this might be coming from either some of the forearm flexors or the finger flexors. So there are no specific names for these, but we can just do a simple finger to thumb test to see if we can aggravate it. Does that bother it?
A little bit.
And as we try to get a little resistance, we're getting a little aggravation in here. So there could be a muscular or tendinitis complex going on, which would indicate maybe a little inflammation. So just to recap that, we're suspicious of some type of inflammation at this joint, whether it's the anatomical snuff box that's usually on the dorsal aspect of the wrist. Being that his pain is more on the palmar aspect, so the volar aspect, I suspect it's going to be something a little different than stenosing tendinosynovitis. So my thought is, if this is coming from osteoarthritis, there's a series of treatments for what we might do for it. Maybe some hand and wrist strengthening, maybe some nighttime splinting and bracing for the wrist, maybe icing it and resting it from activities like the deep tissue massage. Other possibilities, if this is from a tendinitis of sorts, we would do some soft tissue therapies, including what we're going to get into in just a minute, some Graston technique or instrument-assisted soft tissue manipulation, IASTM therapies. We'll go into that in just a bit. We can also stabilize the area by doing kinesio tape. Now to bring in the chiropractic formula for this, sometimes if we have a misaligned carpal bone, the scaphoid or the trapezium, that misalignment can create some problems. So I want to take a couple of seconds here and just demonstrate, without putting too much force into it, if there's going to be any benefit in adjusting this. So again, we did our grind test where we kind of forced this phalange into the joint. We're going to see if we can distract that phalange from the joint, or specifically maybe move either the scaphoid or the trapezium. So we're going to have the patient stand up for this one. And we're going to take this area. I'm going to make my little thumb contact right where the scaphoid would be. Now, a mistake I often see is us pushing down in this way, which kind of closes off that joint. How we're going to adjust this is we're going to see if we can move the scaphoid by pushing our thumb in that direction while opening up, by putting that wrist into ulnar lateral flexion. So that movement right there is going to be an adjustment for the scaphoid if we think that's going to be a necessary treatment for it. Other treatments we're going to bring up, if you have a seat again. One other type of treatments we could do would be an ultrasound treatment. So here's our ultrasound tool, and I'm going to demonstrate this for maybe a minute or two, how this works. Ultrasound is a very useful treatment if we're having, again, either inflammation or some soft tissue adhesions or overuse, where the ultrasound would be used either to reduce the inflammation in the joint or to loosen up the soft tissue. Much as you would use a microwave to cook meat, the ultrasound can be useful. So in this case, the application is pretty simple. It should take about 5 up to 10 minutes. It should be comfortable for the patient. So what we would do in this case, since that's the area of pain, we kind of localize our coupling gel. In this case, it's a just a simple coupling gel, very similar to what they do with an ultrasound that you get in the hospital for a baby. This would be called a therapeutic ultrasound rather than a diagnostic ultrasound. So all you expecting moms that are having the ultrasound done, they'll use the same coupling gel and a very similar looking instrument, but that would be more for diagnostic purposes. We're doing this to treat. So in our case, we're going to use just a simple low setting. We're going to turn this little sucker on. You see the little beeps over here, and then we're going to set our mode, and we're going to put our mode on the low mode, and then we're just going to set the time. I'm going to set it for 5 minutes, and we're just going to perform our little treatment. Now sometimes the patient can feel a little minor vibration. You feeling any vibration or any pain there?
No pain.
Just a little vibration? So again, the purpose of an ultrasound is to basically direct sound waves at the joint. Much like using sonar as a fisherman, you're directing these sound impulses, and when those sound impulses kind of bounce back to the sonar reader, you can see the picture of a fish or something under the water, just like the diagnostic ultrasound would send these sound impulses that bounce back to form images of, let's say, a baby. This is sending these sound waves to see if we can either dissipate inflammation or deep heat the muscle tissue. So again, this is as exciting as watching paint dry. So I'm not going to spend too much time doing this, but in essence what we're doing is we're making sure the patient's comfortable. There are some contraindications to the ultrasound, which would include somebody in their early teen years, where you're not in your early teen years, are you? Where this potentially could burn the periosteum if we don't move it. So one good advice would be to just keep that ultrasound head moving. And for all of you soon to be practicing doctors or physical therapists, keeping it moving slowly, I term it polishing a quarter. So if I'm here and I'm trying to polish a quarter, a nice small little area, and we're going to do this for the allotted time, in this case between 5 and 10 minutes. So we're going to stop that for the time being because it's kind of dull and boring. We'll clear this instrument off in just a second. Now another technique we might do, on me for a second, I'm going to disappear from screen and I'm going to get some paper. I want to perform maybe just a quick little session, if you don't mind, of what we'll call IASTM. Some of the more name brand versions of IASTM would include Factor and Graston. And in this situation, what we're trying to do is smooth out some of the muscular adhesions inside this wrist joint. So we have our thenar muscles, we have some of our wrist flexors, and some of our finger flexors that are crossing over this area. We also have this transverse ligament here that encapsulates that median nerve. We're going to see if we can loosen up some of that tissue, iron it out, loosen it up, whatever term you might want to call it. Every practice has their rationale for doing it, but in essence, if you will, we're just trying to make this area a little bit more comfortable for the patient. So think of this like a very spot-specific massage for the soft tissue. Now in this case, I'm using this shaped instrument. There's tons of different instruments. There are Graston instruments. These are the Zuka tools. So what I'm doing here, assuming that some of this is coming out of that thenar eminence, is I'm just doing a little bit of a sweep stroke back and forth to see if we can break up the adhesions. That's not too uncomfortable for you, sir? Now, this is somewhat of a very specific shaped instrument that's great for the extremities. And we're going to use it through here to help break up in both directions some of this soft tissue that might be impeding or affecting that area. Now we're going to, again, this is going to be a very abbreviated session, but as you can see, we're doing some of our sweeping or scanning strokes in both directions. We're angling this not at 90 degrees, but at a nice 30 to 45 degree tilt. We're working not just at the area in question, but working distal to it, because these tendons and these ligaments and these insertions of these muscles are going to go way past this region. Now we would also, if it fits, this wouldn't be a good tool for it, so we're going to switch tools for a second. We can use a different tool to work into the soft tissue of the forearm. So again, our strokes are going to be comfortable for the patient. Is that comfortable?
Yes.
And we're going at, again, not a 90 degree angle, at a slight incline, 30 to 45 degrees, upwards to 60 degrees. And then we're going to be coming back in both directions. Now we're going to be working on all aspects of it, both proximal to the joint in question, distal to the joint in question, and some people even theorize to do both front and back of the region. So we actually might have some interplay with some of those wrist and finger extensors, specifically the muscles that are involved in that de Quervain syndrome we talked about before. Now, the technique we're doing isn't quite enough for us, so I'm going to switch tools again, and we're going to get an instrument that we can do. That's going to be a little too big over here. I guess we'll use the same instrument with our beveled tips. We're going to do what's called a framing stroke in this region. So if we imagine this is the interplay of a lot of different of the wrist bones. So we have our phalange and we have our carpal bones. We're going to come in here, we're going to see if we can open up the joint, and we're going to see if we can very specifically break up these areas of scar tissue. So if you imagine we have, if this is a wrist that just needs cleaning, we're kind of scrubbing it, breaking up the adhesions right around those wrist carpal bones. And we're going to mix in a little bit more therapy over here, what's called a scoop in both directions. Now, a little bit more interplay here. We might include some of the interosseous tissue here that sit between the bones. We're doing what's called a swivel stroke. So I'm going to use that beveled point and I'm going to try to approximate it between the phalanges and do a little swivel in here, kind of like you would when a massage therapist gets their fingers and kind of rubs deep into the muscle belly, breaking up adhesions in that region. Now we could and should get onto the other side where we're doing a little swivel stroke in the webbing, and then also our little swivel stroke through this region. Now, is that comfortable for the patient? And again, our strokes are going to be starting at about a 30 to 45 degree angle as we scoop and as we scoop. Now, if we had more time on the video, we would demonstrate, we would be doing this both the back of the forearm, the front of the forearm, the palm aspect, and the dorsal aspect of the palm. We'd also be doing it between the digits if we had the time for that. Now, to expedite this one step further, other possible treatments we can do for here would be maybe home recommendations, which would be to brace it. Now, being that he's a massage therapist, he says, you know, Doc, it's really hard for me to work when I got this big fat wrist brace on. So we might, for our gentleman over here, we might make another recommendation, and that would be to do some kinesio tape for it. So I have some pre-cut kinesio tape strips, and I'm going to demonstrate them real briefly. So our thought is this: if this is coming from an overuse of some of these thumb and wrist flexors, we can do a little bit of a test here, or a little bit of a taping here to help stabilize the thumb and the wrist. So these are pre-cut. They're not perfect to size. I would probably angle it a little better for the wrist, but here's what I want to do is I want to put a little stretch to the wrist. I'm going to land it right where I think the problem is. And again, no stretch on the landing point or else it's going to be really easily pulled off. And in this case, I'm just going to take this. I'm going to bring it right along the area that I think is needing facilitation. Now, typically before I do this, I would clean off the surface, but in the process of expediting this, we didn't clean it off properly. A wet nap, some type of alcohol swab to clean up the area would be better. So this would be our facilitator strip to help bolster some of the thumb and the wrist flexors. And then we'll put our anti-inflammatory strip on here, where we stretch it to 100%, drop it back to about 50, and we kind of put it right over the area that we think is most highly inflamed. I'm going to wrap it around the wrist. So again, taping for the wrist might be beneficial. Probably, in my opinion, not as beneficial as a good brace for the wrist. However, for some of us that can't work with a wrist brace on, this kinesio taping of the wrist might suffice for business hours. Again, this is Dr. Ray at Bradford Family Chiropractic treating wrist pain.